This is Gateway 101. In today's live broadcast, I will be talking about fever and some natural remedy to help alleviate fever. Okay? So without wasting much time, let's dive into today's business. This is Gateway 101. Our our aim is to educate the masses, the community, the public on simple health management and simple health prevention, because we strongly believe that prevention is better than cure. So Gateway 101 will place more emphasis on prevention, and will also give you some natural remedy that will help alleviate some symptoms. Okay, so if we're talking about fever, we'll say that fever is a temperature that is above 38 degrees Celsius or 100.4 degrees Fahrenheit. So if your body temperature is above 38 degrees Celsius or is above 100.4 degrees Fahrenheit, you are having a fever. You are feverish. Okay. Although fever is not an illness by itself, but it is a sign that your body is fighting an infection or an inflammation. Okay, and this inflammation might be caused by bacteria, virus, or also certain acute illnesses or chronic illnesses. Okay, so fever is just a temporary rise in body temperature. So like I said, if your temperature is above 38 degrees Celsius or is above 100.4 degrees Fahrenheit, you are having a fever. I would say that fever itself is not really an illness, but it's a sign that your body is fighting an infection or an inflammation. That's just the truth, which can be commonly caused by bacteria or sometimes virus or certain other condition. So let us, in today's broadcast, let us look at what are the common causes of fever. Okay, I will say that reaction, some of the common causes of fever can be a reaction to a vaccine or medication that can cause a fever, mostly Vaseline. Okay, because some people's body cannot tolerate Vaseline, so they reacted to it. So this will cause the body temperature to rise because the body is trying to fight that Vaseline. Okay, in that process, the temperature will rise. So, and if your temperature rises after taking a Vaseline above 38 degrees Celsius or 100.4 degrees Fahrenheit, you know that there are some certain reactions you are reacting to that Vaseline. So that can be a possible cause of fever. Also, certain medication that your body can react to. Okay, it takes antibiotics, for example, and suddenly, boom, before you know it, your temperature skyrocketed. You are reacting to that medication, and the body is trying to fight it. So, in that process, the body temperature will be elevated. Okay, so another possible causes of fever will be heat exhaustion. You're overheated. You find yourself in in a very hot environment. And in that process, you are sweating a lot. This can also cause your body temperature to rise above 38 degrees Celsius or 100.4 degrees Fahrenheit. In that process, we said you are having a fever. Inflammation or injury can also be a possible cause of fever. So there are some certain injuries you have. Okay, so the body is trying to adjust to that shock, to that injury, or to an inflammation. This will cause your body temperature to rise above 38 degrees Celsius or above 100.4 degrees Fahrenheit. Okay? Bacterial infections such as urinary tract infection, throat infections can also cause your body temperature to rise. Virus infections such as the flu, common cold, COVID-19, etc. can also cause your body temperature to rise. Remember that one of the common symptoms of flu is fever. Also, a common symptom of common cold is fever. That's why if anybody having a temperature above 38 degrees Celsius or 100.4 degrees Fahrenheit, and in this present day, they will say, okay, let's go and test he or she for COVID, because COVID's temperature is a common symptom of COVID. So COVID-19 can also cause your body temperature to spike. Okay, so let's look about the common symptoms of fever. I will say that one of the common symptoms of fever will be loss of appetite. Okay, most people, if they are running temperature, they find it difficult to eat. The appetite will not be there, but it will subside. So even though they are feeling hungry, they just don't have the appetite to eat, because they are running a temperature above 38 degrees Celsius or 100.4 degrees Fahrenheit. They're running this, suffering from feverish. Okay. Another common symptom of fever will be fatigue or weakness. You've been exhausted and you feel very weak, maybe due to losing a lot of fluid from the sweat and all that. You become so weak and fatigued. So your temperature rises above 38 degrees Celsius or 100.4 degrees Fahrenheit. You're having a fever. So common symptom will be fatigue and weakness. Sometimes you're having a body ache, or your body's hot all over, having a severe body ache. Okay, you are having a fever. It's a symptom of fever. Another very, very common of fever is sweating. Most people having feverish, they sweat a lot, they feel tired, and all that stuff. Okay? Sweating is another very common symptom of fever. Okay? Another common symptom of fever would be feeling hot or cold or chill. Okay? Some people are having cold, but they're shivering. If you check that temperature is above 38 degrees Celsius or 100.4 degrees Fahrenheit, so chilling, the shake, feeling feverish is a common symptoms of fever. Okay, so let's talk about, in Gateway 101. Remember, in Gateway 101, we place emphasis on simple home remedy to help alleviate symptoms. Okay, so in a feverish condition or for those suffering from fever, let's take a look at some common home remedy that we can use to help alleviate fever. So this helps reduce discomfort and support recovery. They may not really replace medical care if fever is high or persistent. Okay, these are simple home remedy that you can use to alleviate symptoms of fever. They may not really replace proper medical treatment, but if the fever persists, okay, so the first thing we'll say, the first simple home remedy that we will recommend here will be stay well hydrated, because dehydration causes feverish too, as you know. So, because mostly for those who are sweating, losing a lot of fluid. So, we encourage you to drink a room temperature water if you're having a fever. So, stay well hydrated. Drink water, coconut water, organic, will be of great benefit if you're having a feverish. Okay, and herbal tea or clear soup that is warm, lukewarm, will be of great benefit if you're having a fever. Okay, because fever causes flu shift or losing flu through sweating. So if you are sweating a lot, you will definitely lose a lot of fluid. So stay hydrated if you're having a fever. And don't forget, we say that if your temperature is above 38 degrees Celsius, if your temperature is above 100.4 degrees Fahrenheit, you are having a fever. And we encourage you that one of our simple home remedy will be drink a lot of fluid, stay hydrated. You can drink coconut water, and herbal tea will be of great benefit, and also a clear soup, but make sure it is warm, lukewarm. Okay, because fever causes flu loose through sweating. Another home remedy that we would recommend would be rest adequately. Okay, because sleep helps your body immune system to fight infection. If your body is at rest, it boosts up your immune system. So if you're having a fever, we'll encourage you to rest adequately. And remember what we said, that this may not be a proper, this may not replace a proper medical treatment if the fever persists. So we strongly encourage you to see your medical provider immediately, mostly if the fever lasts more than 2 to 3 days. So seek medical attention immediately. Okay, so because Gateway 101 will focuses more on prevention, which teaches people about a common home remedy that they can use to alleviate symptoms. Okay, but if the fever persists more than 2 to 3 days, we strongly encourage you to see your medical provider ASAP. Okay, so on that, number 3, remember we're talking about effective home remedy for fever. So number 3, lukewarm sponge bath. Never use cold water to take a bath if you're having a fever. Okay, you use lukewarm sponge water. It will be your great health benefit. Okay, gently sponge the body with lukewarm, not cold water. Lukewarm water, please note. Okay, so like I said, if you're having a fever, we actually encourage you to drink a room temperature water or a lukewarm water. Okay, so avoid ice water if you're having a fever. Okay, because drinking ice water can actually worsen your chill if you are feeling chills, shaking, cold. Okay, it can actually worsen your chills. So take a lukewarm water or room temperature water. That will help alleviate the symptoms. We also encourage you to take some herbal drinks. If you're having a fever, herbal drinks such as ginger tea. Okay, ginger tea, as we all know, it helps with inflammation. Ginger tea will help reduce inflammation. So if you're having a fever, I will encourage you to drink some ginger tea. And also Toxi, Holy Baxa tea. Toxi is TULSI, commonly known as Holy Baxa tea. Okay, Toxi tea supports, as we all know, it supports the immune system. Yeah, it boosts your immune system. So if you're having a fever, you can take that too. Okay, lemon with honey, traditional home remedy or grandma therapy for common cold and fever. Lemon with honey, smoothie with hydrating. This is not for children under the age of 1. Don't go and give lemon and honey to children under the age of 1. Okay, don't do that. It is no. Okay, so warm fluid. Having a fever, I will actually encourage you to take some warm fluid, such as chicken soup. Drink some warm chicken soup or vegetable broth. This can help alleviate the symptom of fever. Okay, so drink some warm soup, vegetable chicken broth. This can help with comfort and hydration if you're having a fever. If you're having a fever, we also encourage you to do some light food, such as fruit, brown rice, yogurt. Avoid heavy greasy food if you are having a fever. Avoid heavy, greasy food if you are having a fever. Okay? We also encourage you to avoid alcohol or caffeine if you are having a fever. Okay? Because drinking alcohol when you're having a fever will actually worsen your symptoms. So please note, okay, if you're having a fever and you should stay away from alcohol or cigarette. We also encourage you to stay away from cold bath or ice pack if you're having a fever. And don't overwork yourself if you're having this overextension. Don't do that to yourself if you're running a fever. Okay, so when to see a medical provider if you are having a fever? When is it necessary for you to seek medical help? Remember, we said that a fever is a temperature above 38 degrees Celsius or a temperature above 100.4 degrees Fahrenheit. And we are saying that if you're having a fever that is persistent or that lasts for more than 2 to 3 days, do not hesitate to seek a medical attention. Okay? Because any fever that lasts that long might be something major that the body is trying to weigh off, but it cannot. So you need to see your medical provider immediately if your fever lasts more than 2 to 3 days. Okay? When to see a medical provider? If your fever now get above 39 degrees Celsius or 102 degrees Fahrenheit, this is a medical emergency. See your medical provider or go to the nearest urgent care clinic immediately. Okay? Severe headache, stiffness, confusion, chest pain. If you are having this symptom, these are serious medical emergency. You need some serious medical attention. You are having a fever that is persistent and then you're now feeling severe headache. Your neck becomes stiff and you're a little bit disorientated, a little bit confused, complaining of chest pain. Strongly encourage you to see your medical provider immediately. These are some serious symptoms. Okay? You're having a fever, you have persistent vomiting, or you have a rash all over your body. This is a medical emergency. See your medical provider immediately. Okay? Or you're having a fever in infant, elderly, or people with chronic illness. If an infant is having a fever, elderly, or people with chronic illness, you need to seek a medical advice immediately. Okay? So, important note, fever is often helpful. It shows your immune system is working. The goal is to stay comfortable and hydrated. Okay? Fever, like we said, is not an illness to some extent, but is a sign of, is your body giving you a sign that something is not right. Okay? So it often helpful because it shows your immune system is actually working. The goal is to stay comfortable and hydrated, not always to eliminate fever immediately. Okay? So let us recap again for those of you who are just joining this live broadcast. Like we said, this is Gateway 101. We place more emphasis in prevention, teaching the community how to prevent simple home remedy that you can put in place to prevent illnesses, and simple home remedy that will help alleviate common symptoms. I will also say that this may not replace the proper medical care, but these are simple home remedies that can help alleviate symptoms. I will strongly encourage you to seek medical advice if fever lasted more than 2 to 3 days. Your temperature is above 39 degrees Celsius or 102 degrees Fahrenheit. These are medical emergencies. So talk to your medical provider or shake yourself into the nearest urgent care clinic, because it might be something really serious that the body is trying to fight and it's unable to do that. Okay, like we said, that fever is when your body temperature is above 38 degrees Celsius or 100.4 degrees. If your body temperature is above that, they will say you're having a fever. I will also say that it is not an illness by itself, but it is a sign that your body is fighting an infection or an inflammation, commonly caused by virus or bacteria, or sometimes some other condition in the body. So I would say that the common causes of fever would be people reacting to Vaseline or reacting to medication. So there are some people, when they take the flu Vaseline or they take some certain Vaseline, COVID Vaseline, and also their body react, and that can cause fever. Also, the cause of blood transfusion. And if you notice the patient is going through blood transfusion and begin to develop fever, begin to develop rash, his body reacting. So that blood transfusion should be stopped immediately and notify the medical provider. Okay, so reaction to Vaseline is a common cause of fever. Reaction to some certain medication, mostly antibiotics, is a common cause of fever. Then inflammation or injuries. Okay, major injury, for example, can lead to fever, because the body will try to adjust, will try to regulate, try to fight off. In that process, the temperature will spike. So I will also say that a common urinary tract infection can also cause fever, or throat infection can also cause fever. Even bacterial infection, I will say that flu, one of the major symptoms of flu, is fever. When the person running the temperature, mostly at this time of the year when it is cold, you come to the clinic and you are spiking the temperature, the first thing you suspect is probably having a flu or common cold or COVID-19. So the first thing they do is check your body temperature to see whether your temperature is above 38 degrees or 100.4 degrees Fahrenheit. So if you're having a body temperature of 39 degrees, for example, or 102, they'll definitely going to suspect fever and suspect flu, common cold, or COVID-19 at this time of the year when it is cold. So you will be tested, you will be diagnosed, you will be examined properly to know whether it is flu, it is common cold, or it is COVID-19 or some other causes. So I also said that the common symptoms of fever will be you feeling hot or cold, you shaking, shivers. Those are some of the common causes of fever. common symptoms, common symptoms of fever, to say you're feeling hot, or you are cold, or you are chilled, you're shaking, having cold. These are common symptoms of fever. Or you are sweating. You are under a cold environment, but you are sweating. That is a common symptom of fever. Body ache. You're having a body ache. Hot all over. Generalized body ache. General body ache. Hot and all over. It's a common symptom of fever. You have a persistent headache. It's a common symptom of fever. Okay? And you feel so tired, weak, fatigue. Is a common symptom of fever. Okay? You lose appetite. Even though you are hungry, but you don't feel like eating at all. You don't have the appetite to eat. That is a common symptom of fever. And we also said that we have an effective home remedy for fever. Remember, in Gateway 101, we place emphasis on prevention and simple home remedy to help alleviate illnesses. So we have some common home remedy for fever. I will say that this common home remedy will help reduce discomfort and support recovery. And they may not replace proper medical care if fever is higher or is persistent. I will say that if you're having a fever that has been on for 2 to 3 days, you have to seek a proper medical attention. If you're having a fever that is above 39 degrees Celsius, you have to seek a proper medical attention. If you're having a fever of 102 degrees Fahrenheit, you need to seek a proper medical assistance. But if the home remedy is to reduce discomfort and support recovery. Okay, so that's our goal in Gateway 101. We'll teach you. We will place so much emphasis on prevention, and we also teaches you a simple home remedy to reduce discomfort and support recovery. Okay, and we said that one of the things that you're going to be doing for a simple home remedy to help you recover from fever will be stay hydrated. Drink water. Drink coconut water. Drink herbal tea and clear soup. And make sure everything is lukewarm or above or room temperature. Don't drink anything cold if you're having a fever, because it will aggravate it. Okay, so stay hydrated. I also encourage you to remember that fever causes fluid loss through sweating. So stay hydrated. Okay, I also encourage you to get adequate rest if you're having a fever. But if the body is at rest, it boosts the immune system. Okay, because sleep helps your immune system to build. Okay, sleep helps your immune system actually to fight off infection. So get adequate rest if you are having a fever. Very important. Okay. We also encourage you to take a sponge bath, a lukewarm sponge bath. Gently sponge the body with lukewarm, not cold water if you're having a fever. Please note, okay? Avoid ice water if you're having a fever, okay? Because it can worsen the symptoms. Mostly for those who are feeling cold and chill, drinking a cold water can actually worsen the symptoms. So drink water under room temperature or lukewarm water. Okay. To also say that if you're having a fever, you should wear light clothes or and cold, light clothing. Okay, wear something that is very light if you're having a fever, and keep your room comfortable, cool, not cold. Okay, there's a difference between the cool environment and cold environment. So you're having a fever, your room should be comfortably cool, not cold. Cool, COOL, not COLD. They are two different things entirely. So take note. And we also encourage you to take herbal drinks, such as ginger tea. Having a fever, ginger tea will help reduce inflammation. Okay, so get some ginger tea from your local grocery stores. If you have some at home, get some warm water and make a tea. Drink ginger tea. And also drink Toxi, commonly known as holy basil tea, because this supports your immune system. Yeah, it's home remedies. Then Grandma therapy, lemon and honey for fever. Lemon and honey smoothie and hydrating. It is very, very important if you're having a fever. But remember, never give lemon and honey to a child or children under the age of 1. Don't do that. Okay? This is a grandma therapy, lemon and honey. But don't give it to children under 1 year. It is not recommended at all. Okay? Then drink warm fluid. Having a fever, drink warm fluid. Lukewarm or room temperature of chicken soup or vegetable broth can help comfort and hydration. Nutrition will say if you're having a fever, eat light food. Eat something light like fruit, veggie, brown rice, yogurt, and will encourage you to actually to stay away from heavy, greasy food if you are having a fever. Okay, so what to avoid if you're having a fever? What do you actually have to avoid if you're having a fever? I will strongly encourage you to stay away from cigarette smoking if you're having a fever. Stay away from alcohol. You don't need to take alcohol when you are having fever. You want something that will boost your immune system, not something to fight your immune system. Okay, so stay away from alcohol, caffeine, or cigarette if you're having a fever. Don't take a cold bath if you're having a fever, or ice pack. Don't do that if you're having a fever. Stay away from cold bath or ice pack if you're having a fever, okay? And we also said that when to see a medical doctor. We said seek a medical help if your fever is above 39 degrees Fahrenheit or 39 degrees Celsius or 39 degrees Celsius or 102 degrees Fahrenheit. You should seek a medical attention immediately. Okay. We also said that you seek a medical attention immediately if your fever have lasted for more than 2 to 3 days. Persistence 2 to 3 days. Your growing temperature. Seek a medical attention immediately. Okay. You also have severe headache. Running a fever with a severe headache. Seek a medical attention immediately. You have a stiff neck and you're running temperature. Please go to your doctor, go to the nearest urgent care clinic to get some help. You are a little bit confused. You're disorientated. You're having a fever. You're disorientated. It's a sign for concern. Seek medical help immediately. Having a chest pain and having a fever. Please get some medical attention ASAP. persistent vomiting, throwing up, nausea, vomiting, diarrhea, have rashes, and you are sparking temperature, having a fever, please go and seek medical attention immediately. So fever in infant, elderly people, or people with chronic illness, please seek medical attention ASAP. Fever, like I have said before, is often helpful. It shows that your immune system is actually working. Okay? So the goal is to stay comfortable and hydrated, not always to eliminate the fever immediately. Okay? So let's talk about fever management. How do we manage fever? Fever management. Remember, we said that fever is actually your natural body responding to infection or inflammation. Okay, the body is responding to responding to infection or inflammation. Okay, fever itself is not an illness, but it's your body responding to illness. Your body responding to infection or inflammation. So management depends on how high the fever is. Okay? That's why we say that if your temperature is 39 degrees Celsius or 102 degrees Fahrenheit, you should seek medical attention. Okay? But if it is below that, simple home remedy might help reduce the symptoms. Okay? So managing fever depends on how high your temperature is and how you actually feel. Okay, and who has the fever? Is it adult, child, or baby? So these are some of the things that we put into consideration when managing the fever. Okay. Okay, so managing fever using medication. Medication help reduce discomfort, but not necessarily cure the cause. Okay, taking medication for fever such as ibuprofen, Tylenol, or fever reducer may actually help to alleviate the fever, but is not actually curing the cause of the fever. So common fever reduce medication for adults and children, age appropriate dose, like paracetamol, also known as Tylenol or acetaminophen. This help reducing fever and pain. Okay, gentle on the stomach. Do not exceed recommended dose, because this might cause liver damage. Okay, ibuprofen reduces fever also. It reduces pain. It also reduces inflammation. But we also encourage you to take ibuprofen with food. Okay, because this avoid if you are having a stomach ulcer. So we encourage you to, if you are taking ibuprofen to reduce fever or pain or inflammation, take it with food, because this will help. Because if you're having a stomach ulcer, kidney disease, or you are dehydrated, please don't take ibuprofen, because ibuprofen will worsen your stomach ulcer and also your kidney. If you're already having a kidney disease, you're having a stomach ulcer, you are dehydrated, please avoid taking ibuprofen. Okay, and do not use aspirin in children or teenagers. Risk of Reyer syndrome, Reye syndrome, REYE. Okay, please note that we do not use aspirin in children or teenagers because of risk of Reye syndrome. REYE syndromes. REYE syndrome. Natural and home fever management. I would say that this helps support recovery because this does not constitute proper medical treatment, but it helps alleviate the symptoms. Okay, I would say that stay well hydrated. Okay, drink a lot of water. Oral rehydration solution. Drink herbal tea. Drink clear soup because fever do cause the fluid to sweating. Okay, don't forget now we're talking about fever management. I would say rest, adequate sleep, adequate rest help the immune system to do what? To fight infection. So get adequate rest if you're having a fever. You don't want to overwork yourself if you're having a fever because that would aggravate it. So get some rest. Because if your body is at rest, guess what? You boost your immune system. Okay? Avoid strenuous exercises. You can't be having a fever if you are doing a vigorous exercise. That would not be the best time to do that. Okay? So avoid strenuous activity if you're having a fever. Okay? We also encourage you to dress light. If you're having a fever, dress very light. Very, very important. Okay? If you're having a fever. And wear something that is light clothing. Use a light blanket if chilly or cold. Okay? Avoid heavy blanket because that can trap heat. So if you're having chills, avoid using heavy blanket because that can actually trap heat. Okay, we're still talking about fever management. So I would say lukewarm sponging. Use lukewarm water, not cold water, to gently sponge your body. Because it helps cool the body gently. Uses a lukewarm water to gently sponge the body, help cool the body gently. Avoid cold bath if you're having chills. Avoid ice cold bath, if you're having a fever, because it can cause shivering and raises body temperature. Okay, so natural comfort remedy for fever. We'll say that these do not replace medical, but help. Natural home remedy does not replace proper medical treatment, okay? But it helps recovery. It reduces discomfort. And that's our emphasis at Gateway 101, which teaches you a simple home remedy to help alleviate symptoms, to help reduce discomfort. That's all we do at Gateway 101, placing emphasis on prevention because we believe that prevention is better than cure. So natural comfort remedy does not represent proper medical treatment if you are having a fever. So warm lemon water with honey will help if you're having a fever. Warm lemon water with honey will help if you're having a fever. We also encourage you to drink ginger or herbal tea if you're having a fever. Drink ginger or herbal tea. We also encourage you to eat light meal, something like fruit and soup, clear soup, and avoid heavy grazing food if you're having a fever. Okay? Another natural comfort remedy would be avoid alcohol and stay away from a very sugary drink. Okay? Because if you're having a fever, your body immune system is fighting at this time. So you want something that will actually go to boost your immune system. So drinking alcohol will not boost your immune system. So avoid alcohol if you're having a fever. And also a very sugary drink will not boost your immune system. It will actually weaken it. So if you're having a fever, stay away from a very sugary drinks. Okay? So we're talking about fever management. We're saying that when fever needs medication, when do we start, what are we supposed to take medication if you're having a fever? So seek medical care. When fever needs medical attention, I would say that seek medical care if you have a persistent fever that have lasted for more than 2 to 3 days. Seek medical attention immediately. Your fever is greater than 39 degrees Celsius, 102 degrees or 102.2 degrees Fahrenheit in adult. Seek medical attention. Okay? Fever lasting more than 2 to 3 days. Please seek medical attention. You have persistent severe headache. Please seek medical attention. You have stiff neck. Please seek medical attention. Or you're a little bit confused, disoriented, or mental status. Please seek medical attention. Okay? And you having a chest pain or difficulty breathing, and you are having a fever, you're running a temperature of 39 degrees to 39 degrees Celsius or 102.2 degrees Fahrenheit in an adult, you're having a chest pain, you're having a temperature, please, you're having difficulty breathing, please seek medical attention. Okay? And if you have children, if you have fever in children, babies under 3 months, seek medical attention. If you're having a fever and you are pregnant, please seek medical attention. People with chronic illnesses such as diabetes, heart disease, cancer, high blood pressure, and you're running the temperatures persistent that have lasted more than 2 to 3 days, please seek medical attention. Important note, please know that fever himself is not always dangerous. Okay, so treat the cause, not just the temperature. Avoid antibiotics unless prescribed. Fever is often viral. Okay, that's why I said that antibiotics, if you're taking antibiotics for fever, they got to be prescribed by your medical provider. Okay, don't just go and take some leftover medication for fever. Yeah, so if you are taking over the counter medication, it should be ibuprofen or Tylenol, and you are having a kidney, liver problem or stomach ulcer, stay away from ibuprofen because it will actually go to worsen it. I also said that don't give aspirin to children or teenagers for fever. Seek medical attention. Okay? So avoid antibiotics because unless it is prescribed, if it's not prescribed, take it. You don't even know whether it is virus or bacteria. So you're taking medication that you don't know anything about. So we'll always encourage you to seek medical attention again for 101 because our aim is to teach the community. Okay? Our aim is to teach the community how to prevent illnesses. Simple home remedy to reduce discomfort. This does not constitute proper medical treatment or does not replace proper medical treatment. Mostly if you are running a temperature of 39 degrees Celsius or 102 degrees Fahrenheit, seek medical attention. Okay? So simple rules for mild fever, feeling okay, natural care. High fever or discomfort, medication and rest. Persistent or severe symptom, seek medical help ASAP. Okay, so let us recap again. I think we did good today for those of you who are just, for sake of those who are joining us. Okay, please kindly share and subscribe. Okay, kindly share and subscribe because we teaches you a lot of home remedy that will help alleviate um, various illnesses. We teaches you a lot of prevention measures that we put in place that will help you to stop running to the doctor every here and there. Because prevention is better than cure. So we put a lot of emphasis on prevention. So do not forget to subscribe because we do drop out videos on daily basis. So if you subscribe and you're following us, you will be able to receive these medical tips, medical prevention, home remedies to help alleviate these illnesses, to help alleviate discomfort, to help reduce discomfort. So do not forget to share and subscribe. Okay? So we are recapping again for the sake of those who are just joining us. We're recapping again. Okay, I was saying that fever in your body does not really mean illness, but it's your body responding to inflammation or infection. So management depends on how high the fever is and how you feel, or who is having the fever. Is it adult, child, or baby? Okay. I will say that managing fever with medication will say that medication help reduce discomfort, but does not cure the cause. Does not necessarily cure the cause. So common medication for fever will be acetaminophen, paracetamol, Tylenol, because this reducing fever and pain, and it's also gentle on the stomach, but do not exceed the recommended dose, so that you don't be danger for liver problem. Okay, I will also say that you can still take ibuprofen to reduce fever, pain, and inflammation. We also encourage you to take with food because to avoid stomach ulcer. I will also say that if you are having a stomach ulcer, you're having a kidney disease, or you are dehydrated, do not take ibuprofen because it will actually go to worsen your stomach ulcer or your kidney disease. So if you're having these illnesses, don't take ibuprofen. Okay, seek a medical, go and see your doctor. I will also strongly warn that do not use aspirin in children or teenagers for risk of Ryan syndrome. Okay, do not use aspirin in children or teenagers. Risk of Raynaud syndrome. Don't do that. Okay. I will do in GEP 101 is to teach the community simple home remedy, teach community prevention measure, teach community things that they need to know to guide them. Because aspirin is actually over the counter, so you don't go and make the mistake of buying it and giving it to kids. Don't do that. Okay, for the risk of Raynaud syndrome. So I keep emphasizing it because people always take aspirin for headache and this and that. If you're having a stomach ulcer, aspirin is not a good medication for you to take because it will worsen your stomach ulcer. Okay? So, natural and home fever management. We said that they stay hydrated. Okay? But if you're having a fever, you're sweating, you're losing fluid. So stay hydrated. Drink some coconut water that have a lot of electrolyte, mostly organic coconut water, natural, not processed one. Natural coconut water is full of electrolyte and it's good to hydrate the body. Okay? Drink a lot of water if you're having a fever. Stay hydrated, but don't drink excess. Okay? So oral rehydration solution is also encouraged. Herbal tea. Drink some herbal tea. So some ginger tea. Take clear soup. Very important if you're having a fever. Drink some clear soup. Because fever causes fluid loss through sweating. Okay? So the emphasis here will be to replenish the lost fluid. Okay? And we'll say that coconut water is very good to hydrate. Drink also clean, clear water to stay hydrated if you're having a fever. Remember, we're talking about fever management. Okay? We can also say that adequate rest will also go a long way to help, because rest helps the immune system fight infection. Okay? I also say that if you're having a fever, stay away from strenuous exercise, strenuous activities. Stay away from it if you're having a fever. Okay? I also encourage you to dress lightly if you're having a fever. Okay? Wear something light. Okay? Use a light blanket if you are chilled or if she's on call. Okay? Because using heavy blanket will do what? Will trap the heat, and that will not be good for you. That will raise up your temperature. So use a light blanket if you're having a fever or if she's or cold, and avoid this heavy blanket because that will trap the heat and will raise up your blood, raise up your body temperature to alarming stage. Okay, I've also said I use lukewarm sponging. Use a lukewarm water, not cold water. Gently wash your body with a lukewarm water. If you're having a fever, okay, I also said that you should avoid ice cold bath, because ice cold bath can cause shivering, and it can also raise up your body temperature. Okay, so if you're having a fever, please avoid drinking cold water or taking a cold bath, because this will only worsen the situation. Okay, because cold bath or drinking cold water can cause shivering and raises your body temperature. Natural comfort remedy. When we say that this does not replace proper medical treatment. Okay, natural comfort remedy is to help alleviate the symptoms. Okay, so I will recommend that you can actually take a warm lemon water with honey if you're having a fever. I will say that never give warm lemon water with honey to children under the age of 1. Don't do it. Also take ginger or herbal tea. Very important if you're having a fever. This will be a natural comfort remedy. Drink some ginger and herbal tea. Okay? Eat something light. Eat light meal. Okay, such as fruit, soup. Avoid alcohol or a very sugary drink, because alcohol will not help boost your immune system if you're having a fever. It will actually go to reduce it. Okay, so avoid alcohol if you're having a fever, and also avoid a very sugary drink. But this will not help at all boost your immune system. So avoid a very sugary drink. Okay, and we also said that whenever fever, when fever needs medical attention, we said that fever will need a medical attention if the temperature is have stayed persistent for 2 to 3 days, and the temperature have stayed above 39 degrees or have stayed above 39 degrees Celsius or 102 degrees Fahrenheit in adult, you need medical attention ASAP. Okay, you're having a severe headache, you need medical attention ASAP. Okay, you having a stiff neck and fever, this might be meningitis, you don't know, so you need a medical attention ASAP. You are a little bit confused, disorientated, autonomical status, you need medical attention ASAP. Persistent vomiting or dehydration, you need medical attention ASAP. Chest pain or difficulty breathing, you need medical attention ASAP. Fever in babies under 3 months, or you are pregnant, you need medical attention ASAP. And if you are pregnant, please seek medical attention for fever. Don't just take over the kind medication. Okay, if you're having a fever and you are pregnant, please seek medical attention. I would strongly advise you not to take over-the-counter medication. No matter how high or how low the fever is, seek medical attention if you are pregnant. Babies under 3 months, please seek medical attention. Don't go and give yourself over-the-counter medication. Go to your medical provider and seek proper medical attention. Okay? People with chronic illnesses such as diabetes, heart disease, cancer, hypertension, chronic illnesses, please, you're having a fever, don't just take over-the-counter medication without seeing your medical provider first. See your medical provider, okay? An important note, we said that fever himself is not always dangerous. Treat the cause, not just the temperature. Avoid antibiotics unless it is prescribed. Fever is often a virus. Okay, so you can be taking antibiotics, meanwhile it is a virus that causes the fever. Don't take any leftover antibiotics. It is dangerous to your health. Do not take any antibiotics without prescription. You know that your doctor cannot just prescribe antibiotics for you without doing some testing and some diagnosis. You got to be properly checked first to see which medication is resistant to the bacteria or to the virus. So nobody's just going to give you medication without proper diagnosis or proper examination. That's why we emphasize that you seek medical help instead of taking the leftover medication. Because you don't even know what you are taking that medication for, to be honest with you. You're taking a leftover medication that you don't even have idea of what that thing is. You don't know the cause of the fever. So why are you taking the leftover antibiotics? So we encourage you to seek a proper medical attention if your fever persisted more than 2 to 3 days. Okay, so simple rule: mild fever plus feeling okay, natural care, home remedies will help reduce discomfort. to help alleviate pain and fever symptoms. High fever or discomfort, will need some medication. Tylenol, ibuprofen, then adequate rest. But persistent or severe symptoms, please seek medical attention. Seek medical attention. See your doctor ASAP. Okay? Remember that simple home remedy is to help alleviate the system. Okay? This does not replace proper medical care. Okay, so if the fever persists, we strongly encourage you to seek medical help. If the fever persisted, we strongly encourage you to see your medical provider. Okay? If you're vomiting, stiff neck and fever is a common symptom of meningitis, and you know meningitis is very dangerous. So if you're having a stiff neck, you run a fever, you better run to the hospital or run to the nearest urgent care clinic to seek some medical attention. You're vomiting, diarrhea, nausea, you're running a fever, it's a medical attention. You may not need a home remedy for this. So go to the hospital or go to the nearest medical urgent care clinic to seek some help. Okay, so let's talk about stress, what I call stress-induced fever. Stress-induced fever. So I would say that can stress causes fever? The answer is yes. Stress actually causes fever, although it's usually low grade and not due to an infection. This is often called psychogenic fever or stress-induced fever. Okay. Yes, stress can actually cause fever. Okay. And it is, although it is usually low grade fever, in other words, the temperature is not above 38 degrees Celsius or 100.4 degrees Fahrenheit, and not due to an infection. So this is why it is called stress-induced fever or psychogenic fever. Okay, so how does stress rise body temperature? How? I will say that when you are under intense or prolonged stress, emotionally or physically disturbed, or emotionally physically stressed, your body releases stress hormone like adrenaline and cortisol. This can do what? This can disrupt the brain temperature regulating center, the hypothalamus. So it increases metabolic activity, causes inflammation like response. Okay? And all this can lead to mild fever, tropical fever of 99 to 100 degrees Fahrenheit or 39.2 to 38 degrees Celsius, low grade fever. Often come with symptoms like headache. Sometimes you are tired. Sometimes you have this muscle tension. Sometimes you are sweating or chills or anxiety and rapid heartbeat. But these are no signs of infection. No sore throat, cough, pulse, or worsening symptom. So fever may come and go and improve with relaxation because you are stressed. So if you relax, fever might come and go. So how is fever different from how is fever? How is stress fever different from infectious fever? Stress-related fever usually low grade, while infection-related fever often higher than 101 degree Fahrenheit to 38.3 degrees Celsius. Okay, stress-related fever, it is triggered by stress, while infection-related fever is what? It's caused by germs. Germs, caused by germs. Stress-induced fever do what? Improve sleep, relaxation, rest. Why infection-related fever might need medical treatment. Home remedy might reduce the system but may not constitute cure. In stress-related fever, no infection symptoms, while infection-related fever or symptoms like cold, cough, pain, discharge are seen. So what help in stress-related fever? What actually help? Stress management. So you take a deep breath, like Carol said, breathe in for 4 seconds and breathe out for 6 seconds. Do this every 3 to 4 minutes. Okay. Meditation, prayers, gentle exercise reduces stress. Adequate sleep, at least 7 to 9 sleep hours a night, would greatly reduce stress. Hydration, yeah, drink a lot of fluid, but not in excess. Hydration will help reducing stress-induced fever. Avoid excess caffeine. Okay, and also relaxation techniques, warm shower, calming music. Relax to help reduce stress. Okay, when to see a medical doctor if you are having a stress-induced fever? See a medical attention if fever is above 101 degrees Celsius or 38.3 degrees. One, I'm sorry. Seek medical attention if fever is above 101 degree Fahrenheit or 38.3 degrees Celsius. Seek medical attention. Okay? Fever lasting more than 2 to 3 days. Seek medical attention. Or the fever comes with symptoms like severe pain, cough, weight loss, night sweat, or weaknesses. You will need to seek medical attention. Okay? This is Get Well 101. In Get Well 101, do not forget, we places emphasis on prevention because we strongly believe that prevention is better than cure. In Get Well 101, we also teach you a simple home remedy that will help alleviate symptoms of illnesses. Okay, and we also strongly encourage you to seek medical help because the simple home remedy does not constitute a proper or does not replace proper medical treatment or represent cure. So we encourage you to do what? To seek medical attention if you have a persistent fever that have lasted for 2 to 3 days. You're running a temperature of 38 degrees Celsius to 39 or above 39 degrees Celsius that have persisted for more than 2 days. You have a temperature of 101 to 102 degrees Fahrenheit that have persisted for more than 2 days. Please seek medical attention ASAP. Our emphasis is to help give you a home remedy that will alleviate discomfort, that will help alleviate the symptoms. Okay? We'll also teach you a basic preventive measure. What will come your way again? This is Gateway 101. Thank you so much for your time and thank you so much for watching. Do not forget to subscribe because we'll put up videos every day for simple home remedy. Okay? So check us out on our channel, YouTube channel. This is Gateway 101. Thank you for your time and thank you for watching. Stay blessed. Come your way again. Bye for now.